I think the moment I knew I wanted to be a laryngologist was watching someone go into the operating room with a paralyzed vocal cord, unable to speak above a whisper, and then leave the operating room with an implant in their larynx that allows them to speak essentially at a normal volume and with normal qualities of voice. In that instant, I realized this is something I'd like to devote my life to. I'm a otolaryngologist head and neck surgeon with a subspecialty in laryngology, which means I specialize in airway reconstruction, swallowing surgery, and some cough procedures, as well as voice surgery. The most common reason that people come to see me is for hoarseness. And I would say my specific practice also involves a lot of airway stenosis, people who are short of breath and have noisy breathing. When I first meet a patient, our goal is to address their specific concern and determine what the cause is, and then arrive on a treatment pathway. So swallowing can manifest as laryngeal issues. Hoarseness can be simply because we had a cold and our larynx was inflamed, or it can be something more sinister, things like laryngeal cancers, injury from long-term smoking. Systemic disease can often manifest in the larynx, and because it's so sensitive, we often will pick things up early. The other patient group that I treat quite a bit is airway stenosis, which is a narrowing in the airways, usually the upper airways for me. And in those patients, we're able to get people who can barely breathe, breathing fairly normally in a single procedure. So the treatments for airway stenosis begin with respiratory retraining therapy, and then move through airway dilations. There are also endoscopic laser surgeries we do. There are some remucosalization procedures where we'll take a graft from either the inside of the cheek or some skin and actually reline the airway. And then finally we do open airway reconstruction, which is one of my subspecialties, where we will isolate the diseased area in the trachea or the larynx and surgically modify the organ or remove the stenosis to improve on breathing and get people back to where they can breathe more easily. In addition to being a medical doctor, I also have a master's degree in clinical research science, which I use quite frequently. And a lot of the things that we do are based very directly on research we've done here on the Cleveland Clinic, looking at large groups of our patients and determining what is the best treatment for chronic cough? What percentage improvement can we expect with this intervention? So when I'm not in the hospital working, I'm an avid outdoorsman. I spend a lot of time hiking with my family, and I would say that the majority of my other energy goes to raising my two sons, who are both the most energy-consuming part of my life and also one of my favorite things to spend time on.